Well, hello. So I am in my car right now, and I decided to just record this very fast because I think it's a really important question. So I'm Dr. Amig, your friendly rheumatologist from Unabridged MD, and today I really want to talk to you about what about the antibodies that rheumatologists are ordering, that you come to the rheumatologist for. Do they stay or do they go, and what does it mean? All right, so let's talk about what does what is an antibody, what are they here for, and which ones leave, which ones stay, and what does that mean for you? Number one, what's an antibody? So an antibody is a protein that's created in your body, basically when it's in contact with an antigen. So that's all very, very scientific. So let's make it like this. Imagine you find like you're walking outside, and you see that there's a river and you need to cross that river. You're going to actually make a bridge, right? So you have a river, you're making a bridge. And then every time that you're going to be in front of a river that you cannot cross, you know that you need to make a bridge. That's one example. I don't know that that's the best. Another one would be you're in front of a bear. You know what to do by creating a bear spray, and so then every time you're going to be in a bear country, you're going to have a bear spray and you will know how to use it, right? It's basically your body creates something that's going to prevent it from being attacked and not knowing how to respond, because the antibody takes a little bit of time to be created. And it's not like, if you have an infection, it needs sometimes to be created. And that is why antibodies are really what we are creating when we're doing vaccination. It takes a little bit of time. Okay, we have another type of immunity, which is more like direct. You get infected and directly you have some inflammation. Okay, but in the case of antibody, it takes a little bit of time. All right, now that I've said this, there are some good antibodies and some less good antibody. I'd say less good. So the good antibodies are the ones, like we said, if there is an infection, you want to have the antibodies so you can prevent another infection. The less good antibody, and the reason I say less good is that, yes, you can have some less good antibodies if you have rheumatoid arthritis, if you have an autoimmune disorder or condition. I say less good because we do not know if those antibodies maybe in the past, with evolution, or maybe in the future, created something that actually is good for your body. So what I mean by that is that we don't know everything about your body, right? And so, for example, sickle cell disease, which is a disease, actually prevents paludism, right? Or malaria. And so it's the same thing with antibodies. Yes, they can be considered, pathogenic and cause some issues, but it is possible that they were also helping in the past, right? Or at one point, or maybe there is something in your body that's, positive and doesn't necessarily mean that it's all bad. Okay, so those antibodies that can potentially be either associated with an autoimmune disorder or actually causing issues by themselves, right? So those antibodies, what do they mean? Well, number one, you don't make a diagnosis of an autoimmune disorder just based on the antibody. It's really more the clinical symptoms. And then you add the antibody and that you're like, oh yeah, those symptoms make sense with this antibody. So this is what it is. Then we have the antibodies that are pathogenic and that can actually cause harm. We think, for example, the ANCA antibodies probably cause some harm. We think that the dsDNA in lupus in some patients, not all of them, can cause harm. There are some antibodies in nephrology, kidney disease that can cause harm. So there are some antibodies we know can cause harm. So you want to get rid of them. There are some other antibodies like rheumatoid factor, CCP, and rheumatoid arthritis, or positive ANA. They're here, they're going to stay. And they're kind of for us rheumatologists, just a sign of what is going on. And so, right, so for example, someone presents with joint pain, joint swelling, inflammation. You check the rheumatoid factor and the CCP, they come back positive. We are not supposed to check them again. And the reason we are not supposed to check them again is that we know that they don't go away. And that even if they were to go away, so for example, I give some high immunosuppressive agent. So in those cases, I can actually stop those antibodies. But even if that's the case, it doesn't mean that your condition goes away completely. So I think it's really subtle to understand this. But in summary, the antibodies are not all bad. So that's number one. The antibodies don't necessarily mean that they're creating a disease. You can still be in remission and have positive antibodies. And three, not all antibodies can be followed. And just out of this, we don't follow a lot of those antibodies. So if you have a positive ANA or positive SSA or positive SSB or a positive rheumatoid factor or CCP, we don't check those again. And that's really important. There are, on the other hand, some antibodies that we do follow to see if your disease progresses. So for example, the dsDNA is something that we do follow. Some PR3 MPO for Wegener. Sorry, we don't use that. No, we use ANCA vasculitis. We sometimes follow that. I mean, I like to follow them. The science is not clear on if we should follow, like if they mean anything or not. But I think it's individual. For some patient, it actually means something. For some other, it doesn't necessarily mean something. So talk to your rheumatologist, of course, to learn more. But this is really, I thought, something that I wanted to share with you, and I didn't want to forget to talk to you about this. If you're looking for a rheumatologist, I'm currently taking new patients, and I'm really excited about this. And so look at our website, onabridgemd.com, and then also you can contact us at info@onabridgemd. And I look forward to seeing you next time. Take care. Bye-bye.